The COVID-19 pandemic really showed us all the need for resilient and more innovative healthcare systems around the world. And nowhere is that need more pressing than here in Asia, as we've seen. And it's here in Southeast Asia that, every year, more than 70% of mortalities, of deaths, are because of chronic diseases that can be managed, like diabetes, like hypertension, and heart disease. Yet here in this region, we're seeing that healthcare spending as a percentage of GDP is actually the lowest among all the World Health Organization regions. So here to talk about how we can change that and the role of private healthcare systems is Dr. Poramaporn Prasarttong-osoth. Thank you so much for your time. I want to start because you obviously are president. You run the biggest private healthcare chain system here in Thailand, and you were drafted by the government to help with the pandemic response. What did we learn from that? What did you learn about the role of private healthcare systems during the pandemic?
I must say it's not just us, the private healthcare. When we have to deal with COVID, under the government policy, the healthcare policy, the guideline we follow, we do our tasks as a private hospital network. So it's not just us, the whole Thailand working together. And also I have to stress on this, it's not just healthcare organization that can do to assist Thai people to get through the COVID era. Let's say, for example, we receive the vaccine from the government, but the way to distribute across Thailand, we're working with the government, we're working with the retail organization where they provide us the location. It's easy access location for Thai people to get the vaccine. So we do our tasks. Other Thai people, they do their own tasks, whatever they can to help Thailand get through this.
So you really need cooperation from every single part of the healthcare
right.
system, public and private as well, and logistics, which is also an important aspect of that. Now, during the pandemic, as we saw around the world, it was really difficult for hospitals to manage manage and balance treating acute cases, COVID patients that were coming in, as well as balance that with more chronic diseases and patients who needed longer-term care. But you guys found a really innovative way with doubling down on telemedicine and even in-house services to bridge that gap. Tell us about that.
Yes, this is not just we have to take care of the COVID patient. We also have the existing patient, Thai and expat, and also the medical tourism who used to come to get the treatment and care from us. So how we continue during this era. So we have to find other ways to connect it with them to make sure they get the right treatment, the consultation, and also the medicines, or even taking the blood tests. Digital healthcare or teleconsultation in Thailand is actually started before COVID. But at the time, not just the patient, doctors also not into it because they so get used to the way, the convenient way, the traditional way that they do. But once the COVID hits, we haven't started from zero. We developed some system, and the other thing is other hospital and also government have innovative way on teleconsultation. So we just get started and get a kick-off on that, talking to patient through easy way. You do not have to have a software. We can talk to the social media system, lines on whatever that we have at the time, and gradually develop the stable system to make sure everything is safe, the quality, safety for the patient. So we're talking with Thai patients, deliver medicines.
To their homes.
Yes,
right?
And also if it need be, we also have to taking the blood tests or some other investigations. And what I mentioned, it's not just Thai people or expats who live in Thailand. We also have the existing medical tourism who usually come to us regularly. What can we do? We either talk to them on phone or other way as a teleconsultation. And we also deliver the medicine if possible, if the regulation of their country allow.
It sounded like the pandemic really got people used to the idea of telemedicine, and now you're really able to really leverage off of that.
Yes.
I know we've got a poll, and we want to get you involved as well. We're seeing some photos here from the pandemic here. I think they're going to pull up the polling in a little bit.
The previous pictures that must be the vaccination center across Thailand that government, private healthcare, and other local organizations working together.
Fantastic. We're going to pull up the poll in a little bit. Before we get there, it was funny because off of our conversation of having, therapists and having people, for example, healthcare assistants, actually go out and take patients' blood pressure, for example. I actually injured my foot, and I was really surprised that here in Thailand, I actually could get a therapist, physiotherapist, to actually come out to my hotel room to help me, try to recover from that. So, I think it's amazing what we can do now with those kinds of services. And it sounds like you're also doing that on a regular basis as well.
Yes. When you say it as a digital healthcare, things that do not have to rely on the digitalized, but the spreading or accessible of the healthcare can be beyond the hospital. That's the key.
Really meeting patients wherever they need those services.
Yes.
All right, we've got our poll up, so please pull out your phones and participate. The question is, to avoid a healthcare crisis, we must strengthen infrastructure, recruit more medical professionals, encourage private investments, or enact supportive government policies. What do you think? Let us know what you think. It's still going on there. But it looks like there's pretty overwhelming thought there that we really need to enact supportive government policies. What do you think?
In Thailand, the regulations and government policy may not reach the stage or up to date with the digital healthcare or healthcare anywhere, as I say. The regulations still limited to hospital, healthcare provider, and so on. But if we want to distribute the healthcare beyond the location, the building, all of these regulations has to be adjusted. And also the digital systems, electronic payments, and so on, all this will support the healthcare.
Great. Are you getting the sense that government is being more open to supportive policies that would help, systems like yours, private hospital systems like yours? Are we seeing that post-pandemic? Are you engaging and having those conversations now?
I think they do, because when I mentioned that we developed the digital consultation before COVID, at the time it hasn't been supported by government just yet. But during the COVID time, they realized that this is a new way for people to get access to healthcare. So the regulation has changed that we can do that without, practicing illegally.
That's great. Well, please continue, and interesting results there. One of the things I wanted to ask you about with telemedicine, because off of our conversation at the Bloomberg CEO Forum that we recently held last week in Bali, we also had a session on healthcare, and telemedicine was also very important. That we talked to the CEO of Click Doctor, who has a digital platform system where it's mostly digital, and they're really reaching people out in the provinces, people out in, who normally in rural areas who we normally wouldn't get access to. And I wonder if you can talk a little bit about how telemedicine can really help to bridge that gap and to really bring more equitable healthcare system to those who normally might not get access because there's such a shortage of doctors?
Telemedicine will not replace the traditional way of healthcare because when you get the chronic disease or a complex disease, you still have to come to see the doctors in person to get the correct treatments, x-rays, and so on in the hospital. But for the preventative or simple disease, some of the disease that can be taken care as through the tele system, that will help on the limitation of the resource, as we all know that number of doctors, especially the specialists in each area, is still limited, not just in Thailand, but across the world. Some region that has limited of even doctors, not specialists. So the tele system will assist not just in Thailand, but globally.
Great. Of course, Thailand is well known for medical tourism. You do have some competition around the region with Korea and as well as Singapore, also known for that. But how are you guys leveraging, medical tourism post-pandemic? What is the value add that you're putting out there?
We see the coming back of the medical tourism already in the past couple of months as a private hospital. But more importantly, what we see ourselves as Thailand, we have environment, we have culture, Thai culture, Thai personality, good location. So we have a high opportunity on this. As I said, not just the treatment in the hospital as a private hospital itself, but to expand the healthcare, medical tourism on wellness and also on preventive, that we can combine the healthcare with tourism, with hotel and other service, including food, to support the wellness tourism.
So for example, you could stay at, the Waldorf Astoria and then be offered a package where, tell us about that. What kind of package would you be offered?
Weight control, skin, beauty. So especially in a nice environment, you want good things onto you. You want to be healthy mentally, physically. You want to go back after your trip to be more healthier and also feeling good to yourself. So this can be add on to our well-known service as a tourism.
That's great. I was going to ask you, what do you think, off of the lessons learned from COVID, what can private healthcare systems, what can they do to help prepare for the next pandemic?
We know ourselves that we have to be adapt and flexible, especially the way that we do in terms of healthcare. We have to go beyond the hospital. But the most important thing, and we think that it's a good thing for not just Thai people, but globally, that every one of us realize that we have to take good care of our health. Some say all the time that we can hear from the news that if you have diabetes, if you overweight, you will have a high risk of having a complication after COVID or other disease that you catch. So if people realize that they have to stay healthy, they will have to take great care of themselves. So whatever happens, we can face that.
And hopefully by having better health before a pandemic,
yes,
you
sure.
might get better results,
Definitely.
right? And they'll be more primed to actually seek vaccines in some of those
Yes.
hospital systems as well. We just have a few minutes left. I wanted to ask you, what do you think is, we've obviously talked about the need for government policies, better government policies. What do you think is another big challenge that healthcare systems here in Southeast Asia face, and how can government as well as private industry work together to overcome that?
if we're not waiting to taking care of health when you already sick or ill, but we move on to focus on preventative, taking great care, either do the check-up, genetic test, or food, or whatever we can do, that will help us to cut down on the healthcare budget.
That's fantastic. Dr. Poramaporn Prasarttong-osoth, thank you so much.
Thank you.